eloquently speaking. Welcome to another episode of Legal Talk, where law meets justice and advocacy meets action. I'm your host, Dr. Vickie Simon, and today we're peeling back the curtain on one of the most urgent and persistent injustices of our time, the healthcare crisis in Black, brown, and underserved communities. This episode isn't about numbers alone. It's not just about policy memos or line items in state budgets. It's about life and death, about systems that were never designed with us in mind, and the power we have to change it. This is about the soul of justice, and today we're asking a bold question, a necessary question. What happens when healthcare is treated like a luxury instead of a human right? Now let's get real. The disparities in healthcare are not accidental. They are absolutely by design. They're the byproduct of generations of systematic neglect, discriminatory policies, and legal infrastructure that too often protects power over people. We're told that the system is broken, but the truth for many of us is functioning exactly as it was built, to exclude, to ignore, and to deny. Black and brown communities continue to receive inferior care, not due to individual bias alone, but due to legal loopholes, budgetary neglect, and an intentional lack of accountability. Now let's just look at the 2023 CDC data. Black women suffered 50.3 deaths per every 100,000 lives that were birthed in the state of Georgia. Now, opposed to our counterparts, white women were 14.5, Hispanic women were 12.4, and Asian women were 10.7. That is nearly 6 million women in America that is living in maternity care deserts. Counties without access to adequate maternal health services. Imagine carrying life inside of you, but being surrounded by a system that doesn't see your worth saving. These are not just statistics. These are survival odds. These are policy decisions playing out in real time, in real bodies. Now, as of September 2025, the Georgia Health Commission, a body that was created and meant to safeguard public health, has not convened, not even once this year. No meetings, no oversight, and no urgency. At the same time, proposed Medicaid cut spendings loom over hundreds and thousands of residents. For many, Medicaid isn't supplemental. It's life support. It's the only way they access paternal care, diabetes treatment, emergency surgeries, or cancer screenings. Meanwhile, hospitals are closing at alarming rates, especially in rural, low-income, and predominantly Black communities. These aren't just medical tragedies, they're legal failures. Now, behind every shuttered emergency room is a policy that wasn't enforced, a commission that didn't meet, and a statute that never had teeth to begin with. Now, let me share a personal story with you. In 2021, I was pregnant again. I was older, but I was wiser. And I was becoming a new mom, but still facing the same system. I was diagnosed with gestational diabetes. I failed my glucose test the first time. The medical recommendation was a rush C-section, immediate, urgent, but something in me said, wait, I need to advocate for myself. My midwife back in Miami, the fabulous Dahlia Porter from the Miami Maternity Center, quietly advised me to pour out half of my glucose drink and fill it with water. Now, are you surprised that I failed my glucose test the second time around? A small act of rebellion, but one that grounded me not only in experience, but also in wisdom. At 9 months pregnant, I was told that my baby was in danger. I was sent into panic, but my intuition, my knowledge overruled the fear. I got in my car, completely in pain, 2 centimeters dilated, and drove to Miami. That's right. I drove to Miami, hours away. And there I delivered a healthy, complicated free baby boy. The C-section, absolutely unnecessary. The fear was manufactured. It was a trap, a cycle that too many women are being caught in when they don't have the tools or the support to question authority. This isn't just my story. It's the story of millions, and it reveals a hard truth. In a system that is broken, self-advocacy becomes survival. Now, let's be clear. What's happening is not just medical negligence. It's legal negligence. Public hospitals can shut down if there are no laws to protect them. State health boards can go inactive without consequences. Black and brown patients are disproportionately misdiagnosed, ignored, or dismissed, and there are often no legal accountability. Even the Black Maternal Health Omnibus Act, introduced with fanfare and urgency, remains stalled in Congress, held up by bureaucracy, apathy, and political games. While lawmakers debate, women are dying. But we are not powerless. If policies created this crisis, policies can absolutely undo it. Here's what you can do right now. Number 1, know your health infrastructure. Find out which hospitals, clinics, and maternal services are in your county. Track closures, and please ask questions. Number 2, demand legislative action. Call on your state reps to reconvene dormant health commissions. Silence cannot be our norm. Number 3, fight for Medicaid protections. Cuts to Medicaid are cuts to life, and that's period. Number 4, support maternal equity bills. From the Omnibus Act to local initiatives, these laws matter. Number 5, tell your story. Share your experience. Submit public comments. Push for accountability. Your voice is a tool. Number 6, vote locally. City councils control health budgets. County commissioners set infrastructure priorities. Elections matter, especially the ones where no one talks about. Now, in closing, the healthcare system in this country wasn't built for us, but it can be reshaped by us through legal advocacy, community action, and relentless truth-telling. We can turn broken system into spaces of care, protection, and equity. Now, in this episode, we talked about that healthcare is not a luxury. But in part B of this episode, I'll go even deeper. I'll highlight grassroots organizations, community-led clinics, and legal strategies being used right now to shift power back to the people. Now, until then, stay informed, stay ethical, and keep serving your community. The law may not have always protected us, but that doesn't mean we stop fighting to make it.